Monday means a new work week for a lot of us, and if you are a parent and you are homeschooling your children now because of COVID-19, we know they won't go back this year, but what about next fall?
Yeah, that's the big question. Our education reporter Elsa Gillis is joining us live after meeting with the state superintendent. And Elsa, they are exploring several options here.
Yes, Damani, Allison, it's clear it will not be business as usual next school year. He told me today we could be looking at a scenario where some students physically go into the school building while some students stay at home and learn remotely, and then they switch so that social distancing at school is possible. Superintendent Mark Johnson said today they're moving into the proactive phase of their response to this crisis after having to react overnight to get remote learning up and running. He is starting a task force with representation from the governor's office, the State Board of Education, DPI, key members of the General Assembly, local school leaders, parents, teachers, and students. He says they need to address improving remote learning and closing the equity gap. They're also tasked with figuring out what the fall will look like.
It's not going to look like a normal school year, but we want to make sure that we get as many students, as much time in the physical school buildings as we possibly can.
And these options they are exploring for next school year, it's a huge deal for so many people across our state. I have much more of that interview to share with you, so be sure to join us tonight at 5 for more. Damani.
A lot of changes possibly for parents as well as students. Elsa Gillis reporting live for us tonight. Thank you.
Breaking in the last 30 minutes, Union County is now reporting its third nursing home with an outbreak now of COVID-19. Officials say the outbreak happened at Autumn Care of Marshville, that's on West Pfeiffer Street. 2 weeks ago, the county reported outbreaks at Monroe Rehabilitation Center and Woodridge Nursing Facility.
By tonight, the Huntersville Oaks Nursing Facility will transition to housing only COVID-19 positive patients. Residents who don't have the virus will move to other facilities around the county. Many family members are worried what that means for their loved ones' care. Well, several families told us they were blindsided by the decision. ATRIUM Health says their plans is to house COVID-19 patients under one roof where they have some of the best equipment in the state. Still, families say that they were not notified in time. They are also concerned with the physical and emotional toll this can have on their loved ones.
Alzheimer's patients have been proven with dementia that they cannot handle change very well. This could put my mother into a tailspin.
Well, we've been following the spike in cases at area nursing homes. A week ago, we told you those facilities had fewer than 1,100 cases and about 60 deaths. Well, since then, the number of cases has gone up more than 500 and the number of deaths more than doubled. And our Mark Becker has been investigating these nursing homes, and today he is at Huntersville Oaks for the move out, and you can see his full report starting tonight at 5 o'clock.
In the last 90 minutes, we got new numbers on the cases in North Carolina. Take a look. Since yesterday, there are now more than 300 new cases and 7 more deaths. In total, the state has had more than 9,000 cases and 300 deaths. To put this into perspective, that's out of nearly 110,000 completed cases. We are still waiting on an update from South Carolina today. We do know they have more than 5,400 confirmed cases. 237 new cases were confirmed yesterday, and there are now a total of 174 deaths statewide.
Well, ATRIUM Health is resuming non-essential surgeries today. The hospital suspended them nearly 5 weeks ago as the number of coronavirus cases began to spike. Now that surgeries can continue, ATRIUM will set up its safety precautions for all patients. That includes testing for COVID-19 before procedures and offering virtual care so some patients can stay at home. Well, Novant Health has also started rescheduling non-essential surgeries that were postponed. The first ones will take place a week from today, May 4th. Patients will be screened for COVID-19 2 days before their procedure.
Hospitals in New York are now trying a new possibility for treating patients with COVID-19 heartburn medicine. So far, 187 patients have enrolled in a clinical trial for famotidine, which is the active ingredient in Pepcid. The researchers want to point out the patients are getting mega doses of the drug injected into them, about 9 times what it would normally take just to treat heartburn. They don't want you to go out and buy a bunch of Pepcid and then take it at home. Preliminary results on the trial are due out in just a few weeks. Today, more businesses are open in Georgia, and many in Tennessee for the very first time in several weeks are opening their doors. So our Dave Faraday went to Tennessee today to see how that reopening is working and what's being done to keep people safe.
Well, we got a chance to talk with several restaurant owners, some who have reopened their dining areas, others who have not. The ones who have are being very careful on how many people they're actually letting inside. Take a look at some of this video in Trade, Tennessee. The Sharpie restaurant opened its dining room early this morning for customers. The owner tells me business has been off as he's only been able to do carryout for weeks now. The governor here in Tennessee announced restaurant dining rooms are allowed to reopen, but only at 50% capacity. The state is also recommending that workers wear masks. Many of the fast food restaurants in Mountain City did not open their dining areas this morning. Other restaurants told us they're planning on waiting a couple more weeks.
We've got about 10 employees, and we've been able to work 4 or 5 of them. I try to give each one like a day so that I could get each one of them a little bit of something to do.
And we checked just a short time ago here in Johnson County, Tennessee. The population is just over 17,000 people. So far, they've only had 2 positive COVID-19 cases here. Back to you.
Well, more money could be coming your way. Congress will try this week to craft a new coronavirus bill, rescue bill, but it's likely to be a battle. Reporter Jacqueline Phil joins us to explain why she doesn't expect the bipartisan cooperation we've seen in the previous aid bills.
Congress is scheduled to be back in Washington next week, but they're already clashing over what a new relief bill to help Americans and local governments should look like. Previous coronavirus aid bills have passed with overwhelming bipartisan support, but now Republicans want to hit the brakes and not take the country further into debt. Democratic leadership wants a bill ready for a vote next week. House Speaker Nancy Pelosi promising there will be aid for state and local governments in the next deal. The National Governors Association has asked Congress for an additional $500 billion. State leaders are grappling with sudden, severe, and widespread revenue losses as the coronavirus outbreak goes on. U.S. Treasury Secretary Steve Mnuchin expects this last bill to be it, but he's pushing lawmakers to focus on infrastructure in this next deal. Reporting outside Washington, Jacqueline Fell, Channel 9 Eyewitness News.
All right, let's break down the proposal from Democrats here. Last week, 2 Democratic congressmen introduced the Emergency Money for People Act. It would give Americans a monthly check until employment gets back to normal. It's $2,000 a month, $4,000 for married couples, and $500 for each child. So a family of 4 would get $5,000 a month. While there would be limits if a single person makes more than $130,000 a year or a married couple makes $260,000, they wouldn't get the money. Well, again, not everyone is on board with this proposal, and they have other ideas. Some suggestions include helping with money to pay your mortgage or rent, help for companies to keep paying you and possibly hire more people, and even spending money on infrastructure projects to get Americans back to work.
Elections have gone on the back burner, but tonight lawmakers will focus on protecting your vote and your health. They're having a virtual town hall at 7 on Zoom and Facebook. They'll talk about how you could safely cast your ballot if social distancing is still required come election season. Charlotte Congresswoman Alma Adams will be one of the panelists. Despite the pandemic, planning for the Republican National Convention in Charlotte is moving full steam ahead. Tonight, City Council could approve 2 parts of the plan. The city could formally accept a $50 million federal grant. CMPD will use that money to keep Charlotte safe during the convention. City Council could also approve a special permitting process for things like protests and parades during the convention. The city did that back in 2012 for the DNC. Right now, there are no plans to change the dates of the RNC. It is still scheduled for August 24th through the 27th. Earlier this month, organizers told us they're committed to following whatever social distancing guidelines are still in place by then. The convention could bring 50,000 people to Charlotte with an economic impact of around $200 million.
Well, current golfers won't get to compete in the Wells Fargo Championship this week, at least not in person. The PGA Tour arranged for a virtual competition to help charity. 25 winners will be involved, and they will randomly draw 1 year per day. The player's score from that year will be used and added daily to help determine a leaderboard. Well, the tournament already donated 10,000 granola bars to Second Harvest Food Bank, and they also plan to donate $500,000 to 10 organizations in Charlotte.